Understanding what happens when we suffer a soft tissue injury can be important because that understanding can guide us in what we do and when we do it. If we understand the stages of repair, we can minimize the period that we're in pain and can optimize the repair process so that we have strong tissues that are less likely to get re-injured. If we fail to appreciate the different stages, we may experience prolonged pain, we may suffer re-injury, and we may fail to regain full function. So let's dive in. Soft tissue includes skin, muscles, tendons, ligaments, fascia, blood vessels, and nerves. These tissues can be disrupted by trauma. That is, a stress that the body is not conditioned to withstand. This trauma often involves a sudden or violent movement, or an impact, or an overstretch, or an extreme muscle contraction, or even combinations of all these things. From the time that trauma is experienced, the clock is ticking and things start to happen within seconds. The moment the trauma occurs and tissue is disrupted, we experience internal bleeding, maybe a little or maybe a lot. Damaged capillaries leak blood and lymph into the surrounding tissues, and at the very same instant, the process of inflammation begins. Inflammation is an amazingly efficient natural process that involves the release of certain natural chemicals from within the damaged cells to the migration of specialized cells that'll help with the repair process. Inflammation continues for several days. This is what we call the acute stage of an injury. Inflammation is natural and generally it should be allowed to run its course. We generally recommend taking painkillers like paracetamol rather than taking anti-inflammatories, as anti-inflammatories will slow the healing down. That being said, sometimes if the pain is extreme, anti-inflammatories may allow you to move, and when it comes to optimal repairs, we know that early movement is usually a good thing. The combination of bleeding and inflammation causes swelling to occur. Apart from the damage to the tiny nerves in the area, swelling is a big contributor to the experience of pain. The best thing you can do to reduce swelling is raise the damaged body part higher than your heart and maybe apply some moderate compression. Ice may be helpful to reduce pain, but keep your application of ice to short exposures of 5 to 10 minutes every hour or so. Keeping ice on continuously will only slow healing down. As the initial pain kicks in, remember there's a fair chance that pain may actually increase in the early hours of an injury, possibly even the first day or two. That's okay, it will pass. Use elevation, moderate compression, painkillers, and maybe intermittent icing, and a day or two in, the pain will then most likely start to reduce. It's important not to panic. Pain is normal and will usually pass quickly if the injury is well managed. Making good decisions and getting professional advice at this stage can reduce your pain and accelerate your healing. The time it takes for pain to reduce will depend on a lot of factors, including the severity of the injury, how you manage it, and how you feel about it. Excessive anxiety can lead to your body and brain becoming more sensitive as it tries to protect you from the threat it perceives, so the pain may stick around longer. Getting good professional advice can help reduce your concerns, but you should be confident that natural healing is already going on. Negative thinking is not helpful at this stage. This next stage, called proliferation, involves the body laying down new tissues. It begins pretty early in the process, with the earliest signs of this being when bleeding resolves, which is generally about 48 to 72 hours after the original trauma. The ruptured blood vessels are repaired, so they no longer leak. This process then moves on to the disrupted fibers of your muscles, tendons, and ligaments. Initially, it's a process of all hands on deck. The little ship's captain inside your body says, grab a hammer, grab some planks, grab some nails, and just patch those holes. I don't care how you do it, just stop the leaks. This initial repair has fibers laid down in all different directions. At this stage, it's not important where they point, so long as the gaps in the tissue are filled. So, with the initial patching done, the bleeding is stopped. Then the inflammation starts to wind down, as it's done its job. And as inflammation resolves and swelling reduces, we can expect that pain will start to drop away. If you've managed the acute stage well, pain will usually reduce rapidly. Poor management will almost always extend the period of pain. For a variety of reasons, in some unfortunate people, pain may become persistent. Managing this can be complicated, so here we're focusing on the normal course of events and hopefully reducing the risk of chronic pain developing in the first place. So, back to proliferation, the laying down of new fibers. The pace at which this occurs can be accelerated by employing modalities like therapeutic laser. The Class 4K laser we use at Success Physio is an evidence-based method of improving soft tissue repair. Our experience with the Class 4K laser is consistent with studies that have shown rapid reduction of pain. Now, your pain is resolved. The tissues are healing. Is that it now? Absolutely not. If you cease your treatment at this stage, you have a strong likelihood of re-injury. Your tissues are almost literally half-baked. The next stage is arguably the most important and must not be neglected. Even as your body starts to lay down new tissue, it is also starting to remodel those tissues. By employing carefully selected stretches and strengthening exercises and applying the appropriate amount of load, the remodeling of tissues takes you towards more resilient tissues that will be up to the task of returning to sport or normal activity. In the case of muscle and tendon, we want the fibers to be aligned along lines of tension so they can effectively transmit force. But overall, we need the fibers to be aligned to suit their purpose. This alignment is totally up to you and your commitment to the long-term repair process. Remodeling occurs over many months. You may be able to return to sport after a few weeks or several weeks, but often you'll need to continue to protect the injured area by using a brace or rigid taping while the tissues regain their full strength. Ultimately, the process of remodeling is going on in our bodies forever. But in the case of recovery from soft tissue injury, you should not neglect this important phase of your rehab. Being pain-free and able to move normally is only part of the battle. You still need to work on building strong tissues that will stand up to the forces you may encounter in your sport or day-to-day life.